Appointment scheduling. Overview: the medical office. The modern medical office is very different from the office of the past, where physicians used to treat their patients, insurance was filed, and eventually, reimbursement was dependent on a fixed percentage of the cost. Currently, large hospitals and corporations generally own multiple medical clinics, and healthcare providers are their employees. Medical practices now have the potential to maintain a patient's health record even without a single paper. Every employee should know the legal aspects of the medical office and must be computer literate. Although there are multiple different medical specialties, the basic functions and skills of any medical office will be similar. The typical medical office usually employs one or more practitioners. To support examining and managing patients, the practitioner may employ nurse practitioners, physician assistants, and other support staff. The primary goal of any medical practice is to deliver quality care while maintaining solid financial practices within the ethics and rules of the medical profession. The physician requires a solid team to achieve this major goal. The administrative staff, including medical administrative assistants, handle the financial aspects of the medical practice. On the other hand, the clinical staff support the providers with patient care. Both the administrative as well as clinical aspects of the practice must run smoothly to attain the ultimate goal of the practice. The overall structure or general makeup of the team may differ among specialties. However, the certified medical assistant and/or certified medical administrative assistant are an integral part of the practice. Duties of a CMAA, Certified Medical Administrative Assistant. Medical administrative assistants are professionals who manage several office tasks at private practice clinics and hospitals. In many cases, medical administrative assistants are also called upon by practitioners to assist with supportive tasks during patient appointments. For working as a medical administrative assistant, one must undergo comprehensive training and comply with the mandates instituted by Health Insurance Portability and Accountability Act, HPCT, and other regulatory authorities. Doing administrative tasks efficiently and in a timely manner will make the office more productive and efficient. On the other hand, a practice that is not managed smoothly and has poor patient service may result in loss of business as well as decreased revenue. The job of a medical administrative assistant requires expertise and regulatory compliance in the fields of data storage and retrieval, in addition to the following standard administrative duties: maintaining and managing the waiting room, examining rooms, and the office, handling phone calls, using verbal and written communication, bookkeeping, maintaining medical records, scheduling appointments, ensuring great customer relations, screening sales representatives, maintaining office supplies, filing insurance forms, efficiently processing the payroll, arranging and managing patient hospitalizations, filing and sorting mail, guiding new patients regarding office hours as well as procedures, applying basic computer skills to office practices, implementing ICD-10 and HCPCS coding for insurance claims, completing medical transcriptions. Introduction to patient scheduling. Undoubtedly, scheduling appointments is one of the major administrative tasks performed in the medical office. Until 1970s, patients usually used to visit a medical office expecting to wait for long hours. In the 21st century, patients have very little tolerance for a wait time in a medical office. Lifestyles have been changed tremendously and people have too busy lives. Scheduling appointments efficiently and in a timely manner is important to ensure the smooth operation of the medical office. Medical administrative assistants must consider various factors when scheduling appointments. It should be remembered that patients who have made an appointment weeks or months in advance want to be attended within 10 to 15 minutes after arriving at the medical office. Patients who are seriously ill or have accidents should be seen as soon as possible on the day of the illness or injury. Methods of appointment scheduling. Two common methods are used for scheduling appointments. Appointments may be scheduled manually, by using an appointment book. Appointments can also be scheduled electronically via a computer. The choice of scheduling methods will depend on the size of the practice, patients' needs, providers' preferences, and the availability of staff responsible for the daily schedule. The following are two methods for patient scheduling. 1. Appointment book scheduling. If the medical office uses a manual method of scheduling appointments for office visits, the medical administrative assistant will need an appointment book. An appointment book usually provides sufficient space for noting appointments for a whole year. It may contain a single sheet for each day along with a separate page for every provider or show a whole week on two facing pages. Some offices choose an appointment book showing only one day at a time in its pages. Others may prefer to see an entire week at a glance. A different color page for every day may also be a great option. The more information needed for scheduling, the greater the pages should be. It should be ensured that the book has sufficient space for all relevant information, e.g., patient's name, cause of visit, telephone number, is subdivided into different time units appropriate for the practice, e.g., 15 or 20-minute intervals, can open easily and flat on the surface or desk where it will be used, and easily adjusts into its storage area when not in use. 2. Computerized appointment scheduling. A typical medical office software will contain an appointment toolbar that needs one click to add a patient, see a calendar, add to the waiting list, or search for available time slots. Different types of softwares offer an advanced search option to define the resources needed for a certain type of appointment. This is a fast method that allows quick searching for available appointment time slots. Typically, the medical administrative assistant enters the desired date, and the schedule for the entire day is displayed on the computer screen, showing available time slots. Another important feature in computerized appointment scheduling systems is searching the appointment database for the next available time slot. Currently, most offices are completely computerized and scheduling appointments are made via computer. The computerized appointment scheduling usually allows the user to jump from several days and times while seeing the other appointments that have already been scheduled. Types of booking. There are various methods available for scheduling appointments in the medical office, including wave scheduling, modified wave scheduling, double booking, fixed scheduling, streaming, and open booking. Most medical offices facilitate and permit established patients to schedule appointments or request appointments using the Internet. Additionally, appointments may be categorized or clustered depending on the type of patient or type of treatment or examination. 1. Structured appointments. Medical offices generally use a method of scheduled or structured appointments for office visits. Each patient is provided a fixed time on the schedule and assigned a specific period for their treatment and examination. The major advantages of this method include proper time management and maximum use of the office facility. In addition, a daily schedule may be developed and charts can be maintained prior to the patient's arrival. Clustering. It is grouping patients with similar needs, conditions, or problems. For example, a gynecology and obstetrics practice may see all pregnant females in the morning time slots and other patients in the afternoon. A pediatric practice may schedule vaccinations of its patients on certain days of the week. Special tests like endoscopies may be scheduled one morning per week. The major advantages to clustering include optimum use of special equipment, feasibility in maintaining control of the schedule, effective use of employees' time, and the potential to provide multiple patients with information about their pertinent condition at the same time. Wave and modified wave. Most outpatient medical practices usually use the wave scheduling method or modify the wave method in ways that work for their specific specialty. With the wave scheduling method, multiple patients are scheduled for the initial 30 minutes of each hour. They are attended in the order that they reach the office. The other 30 minutes of each hour are left open. This technique is very useful in large facilities with various departments providing medical care. For example, multiple patients may arrive for a 10 o'clock appointment, be attended by the physician, be moved to the lab for blood tests, and return to the physician 25 minutes later. The practitioner has the second half of the hour to manage these patients after their blood testing. That second half of each hour is generally utilized as an extra time or a buffer that can be utilized for emergencies, returning phone calls, walk-ins, and activities other than direct patient care. A variation of this method is called the modified wave method. In the modified wave method, 3 or 4 patients are scheduled at the start of each hour, and then 1 patient is scheduled every 15 to 25 minutes into the hour. This modification to the wave method may ensure a more smooth and consistent patient flow. Fixed scheduling. It is the most commonly used system, which divides each hour into 15, 30, 45, or 60 minutes portions. The reason for each patient's encounter will decide the length of time assigned. Patients who do not report or come late can cause main problems in the flow of the day. With this system, it is extremely beneficial to schedule chronically late patients at the end of the day. Streaming. Streaming is a system that can minimize gaps in time and backups. This method is extremely helpful if the equipment is portable and available in all treatment rooms. Medical offices using this method schedule the patient appointments in a steady stream at set appointment times of 15, 30, 45, or 60-minute time intervals. The nature of the appointment determines how much time is assigned for each patient. For example, 60 minutes are allotted for a new patient, 45 minutes are reserved for a stress test, and 15 minutes are assigned for a checkup. Double booking. With the double booking scheduling method, 2 patients can be scheduled for the same period with the same practitioner. This method works great when patients are being moved for diagnostic procedures or testing because it leaves time to attend to both patients without keeping them waiting unnecessarily. A double booking scheduling method is usually preferred for short visits. For example, a medical office of chiropractic may schedule various patients for the same time who require just a maintenance adjustment without any therapy at the time of the visit. 2. Flexible hours. Medical offices that work with flexible hours are open at certain times throughout the week. For example, Tuesday, Thursday, and Saturday office hours might be from 9 a.m. to 6 p.m. And Monday and Wednesday office hours might be from 9 a.m. to 9 p.m. The major challenge with flexible hours is to decide which patients should be preferred to be scheduled for these flexible hours. For example, Saturday appointments may be allotted just for patients whose schedules do not allow weekday appointments. Flexible hours are usually used by group practices, clinics, and family physicians. 3. Open hours. A medical office that works with open hours is only open for specified hours for patient visits during the evening or day. Patients may visit at any time during those specific hours to be attended by the physician in the order of their arrival. Emergency rooms and clinics generally use this open-hour scheduling system, where patients are attended by the practitioner on a first-come, first-served basis. This method may cause patients to wait long hours to be attended. However, no appointment is necessary. Of course, any urgent and life-threatening condition is treated immediately. Determining appointment scheduling needs. 1. Patient's needs. Patients express their needs and preferences in varied ways. A patient might be feeling shyness, uncertainty, fear, or embarrassment. With a patient in an emotional condition, even the slightest imagined or real or miscommunication may lead to an extremely negative response from the patient. The medical administrative assistant should be courteous and maintain his/her professionalism. Before scheduling an appointment, the medical administrative assistant should determine why the patient wants to visit the physician. Receipt of important documentation for referrals when a patient is enrolled in a certain program that needs such documentation. It should be remembered that handling the appointment schedule is the primary responsibility of a medical administrative assistant. He/she should be strive to accommodate a patient's requests whenever possible. However, not if it will overload the routine schedule. For example, if a patient requests a 1 p.m. appointment this Wednesday and there are already patients in that time slot, the medical administrative assistant should politely explain that the appointment cannot be made at this schedule. The patient can be offered a later time on Wednesday or another day at 1 p.m. In simple words, the medical administrative assistant should control the schedule and should not let it control him/her. 2. Providers' preferences and needs. The second factor influencing the scheduling of appointments is the physician's needs and preferences. Physicians may choose to perform procedures and/or physical examinations at specific times during the day. The time slots for those specific times would require showing the type of visit. If there are several different physicians, their priorities may differ and certain rooms may require to be shared. At times during the day, the practitioner is not able to attend patients, and therefore these slots must be blocked out on the appointment schedule. Time slots must also be blocked out when the practitioner has another responsibility, such as nursing home visits and hospital rounds. Time slots may also require to be blocked out for lunch, catch-up, and pharmaceutical representatives. Days should also be blocked out of the appointment schedule for days off, vacation, delivering lectures, attendance at conferences, and other professional tasks. 3. Facilities and equipment requirements. The third important factor affecting the scheduling appointment is the available equipment and facilities. The appointment schedule must be established so that examination rooms or rooms with equipment needed for some specific procedures are available to all physicians who are attending patients. The physical facilities, as well as equipment available in the medical office, may affect the setup of the appointment schedule. The medical administrative assistant should consider these points. How many healthcare providers use the facility? How many procedures and examination rooms are there? Is it essential to re-sterilize instruments between procedures, or more than a single set of instruments is available? There should not be scheduled 2 endoscopies at the same time. For example, if the medical office has just one appropriately equipped procedure room. The medical administrative assistant must fully understand the requirements for procedures to be performed in the medical office, in order to schedule appointments smoothly and accurately. Appointment lengths and intervals. Appointments are most often scheduled at time intervals of 10, 15, or 20 minutes in either a computer or a manual system. An appointment can be scheduled for more than one block, considering the reason and type of appointment. For example, if a 15-minute interval is used, an established patient visiting for his blood pressure check might be scheduled for just a single 15-minute interval and a new patient might be assigned for 2 15-minute intervals. In this case, a 15-minute interval utilizes only a single line and a new patient uses 2 lines on the computer schedule or in the appointment book. If a 10-minute interval is used, it should be remembered that all appointments are scheduled in multiples of 10 minutes. In short, more time should be assigned for new patients, special procedures, and physical examinations than for routine follow-up visits. Scheduling protocols and guidelines. Appointment scheduling guidelines. Whether the patient is requesting and making an appointment in person or by telephone, the medical administrative assistant should be polite and maintain helpful behavior. She should always write the patient's name and telephone number on the schedule while making appointments. In most cases, delays in emergencies are unavoidable. Therefore, schedule modifications can be made rapidly if the telephone number is handy. Some time slots should be left open during each day, perhaps 20 to 25 minutes in the afternoon and in the morning. Invariably, several problems, e.g., emergencies, late patients, may arise and disrupt the regular appointment schedule. These open blocks may facilitate the schedule to catch up as well as to schedule brief appointments as required. New patients. Appointments for new patients are often made through the internet or by telephone. The information exchanged at this encounter is extremely important, and entering the accurate patient's data is imperative. An office brochure may also be mailed to the patient to explain the office's procedures in advance of the appointment. Some medical offices share new patient forms to the patient to be filled out and brought in at the time of the appointment. The medical administrative assistant should follow the below guideline while scheduling an appointment for a new patient. 1. A sufficient amount of time should be allowed for the appointment. For this, she should gather as much information as possible from the patient, such as full name of the patient with correct spelling, mailing address, telephone numbers, reason for the encounter, name of the referring individual or physician insurance plan, responsible party and third-party payer. 2. The medical administrative assistant should explain the office's payment policy to new patients and instruct patients to bring all relevant insurance information. 3. It should be ensured that patients know the office location. If required, concise directions should be provided. 4. Some patients are extremely sensitive about messages or questions left on an answering machine or provided to a coworker. To avoid violating the patient's privacy and confidentiality, the medical administrative assistant should ask the patient if it is convenient to call at work or at home and mention this information in the patient's chart. 5. Before finishing the call, the date and time of the appointment should be reconfirmed. 6. The medical administrative assistant should always check his/her appointment system or book to make sure that he/she has placed the appointment on the right day in the accurate time slot. Established patients. Established patients will be provided return appointments when essential. Most return appointments are scheduled prior to the patient leaving the medical office. The medical administrative assistant should follow the below guideline while scheduling a return appointment. 1. Appointment book or screen should be checked carefully before offering an appointment time. If a specific test, procedure, examination, or X-ray is to be required on the return visit, scheduling 2 patients for the same procedure or test at the same time must be avoided. 2. The medical administrative assistant should offer the patient a specific date and time, asking the patient when he/she would like to come back, as this may elicit indecision. If the offered date and time are not feasible, another specific date and time should be offered. 3. The medical administrative assistant should write the patient's telephone number and name in the appointment book or on the appointment screen. 4. Relevant information about the patient should be transferred to an appointment card and provided to the patient. 5. The appointment book or screen should be double-checked to make a rule out any error. 6. The conversation should be ended with a pleasant word and a smile. Adapting the appointment schedule. Emergencies. When a patient is calling with an emergency condition, the first responsibility of the CMAA, Certified Medical Administrative Assistant, is to determine whether the condition can be managed in the office. The medical office should have a policy for the assessment of the condition. The word "stat" is applied in the medical field to demonstrate that some action should be performed immediately. The CMAA should have a list of all relevant questions to ask the patient, such as, are you experiencing chest pain? Do you have difficulty breathing? How long have you had these symptoms? When multiple different symptoms occur together, they may represent a certain problem. This group of symptoms is usually referred to as a constellation of symptoms. For example, one group of complaints found to represent a certain problem is severe right lower quadrant pain, fever, and nausea. A physician who observes this constellation of complaints considers appendicitis. Patients who are seriously ill. Patients who are acutely ill usually have serious conditions that may or may not be considered life-threatening. These patients require to be attended to as soon as possible, but not essentially on that same day. The CMAA should gather as much information as possible about the patient's medical condition and convey the information to the physician to decide how soon the patient should be attended. For walk-in patients, these are patients who come to the medical office without a scheduled appointment and expect to attend the physician on the same day. In general, the physician will have a prescribed list of steps or set protocol for handling such situations. The CMAA should first determine the cause for the walk-in. Patients with serious medical emergencies require to be attended to immediately. Other patients may be asked to wait in the waiting room while informing the physician of the patient's presence. The physician then makes the decision to attend to the patient or not. If the patient is to be attended, the CMAA should explain the possible time for him/her to be seen by the physician. When the patient leaves the medical office, the CMAA might apologize for the delay and then guide the patient to book an appointment for the next encounter. If the practitioner decides not to attend a walk-in patient, the CMAA will have to inform the patient to make an appointment and to come back later. For late patients always cause problems in the routine schedule. The CMAA should gently but firmly apologize for any delay to attend the late patient. Some medical offices have found that scheduling patients who are habitually late at the end of the day is quite helpful. Additionally, patients should be asked to call the medical office if they know in advance that they are going to be late. Physician delays. In some cases, the physician may call in the office to inform that he or she has been delayed and will come in the office later. If office hours have not yet started, the CMAA should call patients with appointments scheduled early and provide them the choice of visiting later in the day or rescheduling the appointment for the next day. In this case, when patients are waiting in the medical office, the CMAA should inform them immediately if the physician will be late. Patients should always be kept informed. Most patients will understand if they know that they are not ignored or forgotten. If an appointment is rescheduled or canceled, it should be noted in the patient's chart the reason for the rescheduling or cancellation. No-show or missed appointments. A no-show or missed appointment occurs when a patient ignores an appointment and does not inform the medical office. When this occurs, the CMAA should call the patient to determine the reason for the missed appointment and to reschedule the appointment for another time. If the CMAA is unable to contact the patient by telephone, he/she should send a card or email asking the patient to contact the office for rescheduling. The CMAA should note in the patient's chart about the missed appointment and that he/she either mailed a card to the patient to schedule another appointment or reschedule the appointment. Even if the medical practice does not routinely remind patients about their appointments, the CMAA should make sure to remind and call habitually late patients the day before the appointment. Continued missed appointments should be brought to the notice of the physician, who may want to personally call the patient, especially if the patient is seriously ill, or send a letter showing concern for the patient's health. In most cases, the physician may select the termination of the physician-patient relationship. The record of all activities and copies of any letters mailed to the patient should be kept a permanent part of the patient's medical record. Cancellations by the office. The CMAA may have to cancel a patient's appointment in the case when the practitioner is ill, has personal time off, or has an emergency. It should be remembered that patients who must be rescheduled need not be explained the exact reason for the physician's absence. However, when there is an advance notice of the physician's absence, the CMAA should inform patients of appointments cancellation, demonstrating that the practitioner will be away from the office and will come back by a certain date. Patients should be informed of cancellations at least a week before their appointments. If the CMAA has to cancel the patient's appointment on the same day of the appointment, he/she should inform and explain to the patient immediately. Cancellations by the patient. When a patient cancels a scheduled appointment, the CMAA should inquire about the reason for the cancellation from the patient and should note it on the appointment schedule as well as in the patient's chart. The patient should be offered to reschedule at another time. If the patient is being treated for a condition, the CMAA should make sure that the patient understands the importance of the follow-up visit. If a patient cancels appointments habitually, it should be brought to the physician's notice. If a patient cancels a scheduled appointment and there is a full schedule, no action is required. Scheduling for diagnostic testing. Sometimes, patients are transferred to another facility for diagnostic testing or treatment. Diagnostic testing may include laboratory tests, computed tomography, magnetic resonance imaging, radiology, and nuclear medicine studies. These appointments are usually scheduled while the patient is still in the medical office. Before scheduling appointments, the CMAA should determine the exact test the physician needs and how soon the results are required. It should be ensured to indicate to the medical facility if the results are required immediately or stat. The CMAA should also provide the facility the patient's name, telephone number, address, the exact test or tests needed, and any other special guidelines from the physician. On the patient's chart, the name of the outside facility should be noted along with the time and date of the appointment. Scheduling for surgeries. The CMAA also assists with the scheduling of surgical procedures in a hospital surgical room or an outpatient surgical facility. The CMAA should determine the patient's requirement for pre-certification with his/her insurance carrier. The surgical facility will need to know the recommended procedure, the amount of time required, the type of anesthesia needed, and any other special guidelines from the physician. The surgical facility will also require the patient's name, address, telephone number, age, insurance information, and the pre-certification number if needed. The CMAA should always follow the policies and regulations of the surgical facility for pre-admission testing, including laboratory studies, radiological studies, or blood arrangements. The CMAA should also write down all appointment dates, locations, and times for the patient and should make sure that the patient understands where to go and when. Finally, the name of the surgical facility along with the time and date the surgery is scheduled should be noted in the patient's medical chart. Confirming future appointments. Patient reminders. Medical offices use several types of reminders to inform a patient about an appointment has been scheduled on a specific time and date. These reminders may include the appointment card, the telephone call, and the mailed card. Appointment cards. An appointment card is provided to patients when they leave the medical office, which may have the following information: patient's name, time, day, and date of the return visit, provider's name and telephone number. Telephone reminders. All new patients and patients with advanced appointments should get a telephone reminder at least the day before their appointment. Computer systems can place the automated call to the added number and remind the patient about the appointment via a pre-recorded message. It should be remembered that the patient should not be called or left a message unless he/she has been provided permission to do so. Mailed reminder cards. Medical practices may also send reminder cards rather than making phone calls. Reminder cards should be mailed at least 1 week prior to the date of the appointment. Additionally, these are sent after a fixed time period since a patient's last appointment. Sometimes, reminder cards are also sent to alert patients to the requirement for annual examinations, e.g., mammograms, pap smears, or prostate examinations.